ceravitlorum in buffalo and cattle, it having a very significance in the neonatal mortality. In calf mortality, is having a very significance because the toxocera sometimes is occupying the larger space. Animal become weak and is not absorbing the or not assimilating the nutritions or the milk. Animal is having a poor growth and or the diarrhea. So this needs a special attention because sometimes we are not able to diagnose when there is a subclinical. So it is being practiced, it is being advised that at the stage of the 2 to 3 week of time of the calf, the anthelmintic, especially the piperacin, is advocated to eliminate these parasites. Otherwise, this is causing a problem, and the lot of negligence is there in the field by the farmers, and there's a mortality because of it. So this is need a special attention. Next one. Another disease which is canine disease and causing a lot of confusion in the mind of the veterinarians. It is either acute, subacute, sometimes not visible. The occult form of a disease, that is the heartburn disease caused by the Dirophilaria amitis. It is a microfilaria disease, and the microfilaria is being transferred by the mosquitoes to the dog, and then they reach to the dog and to the final destination, that is the heart chambers and the pulmonary arteries, where it is being reside finally and is being adult there and remaining for a very longer of time, to the 5 to 7 years. So it depends upon the load of infection. Sometimes there is a high number of the parasites, high number of the microfilaria, adult parasite, I mean to say the heartworm or the heart chambers, there is a different clinical sign that is being exhibited as intermediate coughing, dyspnea, heart failure, vomiting, anorexia, weight loss. But sometimes the load is not very high, so they remain in the heart chambers, not visible. This is known as the invisible or the occult form of a disease. You need a very special molecular test to diagnose I would say the occult form of a disease, that is by PCR or ELISA. So there are the different medicines being practiced. Ivermectin is the very commonest one in combination with the doxycycline, used for a very longer time. Although there are certain effective medicines like melasonine and are available for the treatment. But more important, this disease is sometimes need a high attention, because by the way, the animal is carrying the load of the diarrhea, and you're not predicting, and you are treating the animal for other diseases, for example, ectoparasites, internal parasites, and by using the ivermectin. And ivermectin is very effective in killing the parasites. So although you are using for the different class, so it's also affecting the heartworms in the chambers. So the death of this Dirophilaria, adult Dirophilaria in the heart, they are causing the toxemia, and the animal may die also. So wherever there is endemicity of a heartworm, it is always have a precaution that the animal should be diagnosed first for the Dirophilaria, then you go for a treatment with the other diseases. Otherwise, sometimes there is a very miss happening. Hemoprodosal, next one, hemoprodosal infection is of different category. It's very common as trypanosomiasis, babesiosis, filariasis. So the acute phase is very common to the veterinarians and to the farmers, and easily identifiable, and a lot of options are there for treatment. But the subclinical stage is also very important. Although you are not having a lot of health problem, but it impair the physiology and impair the health, affecting the performance of the cattle. Next one. So acariasis, again the different grade of infection, you have a lot of option. But most important thing is that this is being neglected by the farmers. So the better approach, whenever there is a sizable infection, the animal is being sprayed by the ectoparasicidal drugs available in the markets. Next one. Now we come to the treatment approach to the parasitic infections, either the clinical or non-clinical. The anthelmintic treatment is most commonly practiced because it increases the productivity by more than 20% if you are using the anthelmintics. And for anthelmintic treatment, we should know the current epidemiology in a particular area. If you know the epidemiology of the parasitic, I am to say the spectrum of the parasites in a particular area, so you can have a better approach at what time you have to use the anthelmintics. So in the parasitic infection, and you have to make a continuous observation on the sickness or the behavior of the sickness behavior. For example, it has been a correlation that inappetence and rumination pattern is being affected in the gastrointestinal nematode infection. There is a regular monitoring of the body score, like fecal consistency, fecal ova counts, and it is being advised in the organized farming sector. You have to go for a fecal examination for the EPG per gram, at least in the 10% population. Then you can go for a different strategy for use of a treatment. Either you are using a mass drenching, it is a strategic one because you know at what time there is a high load of infection, you are advising a treatment. Another is a tactical treatment. Tactical means whenever there is a high load because of some sudden climate change, there is a lot of infection is available in the premises or in the grazing area, you have a ad hoc basis, you can have one dose of anthelmintic. The targeted therapy, as you have been seen in the bronchosis, whenever there is a high load, then you are only advised for a targeted therapy. Means whenever the animal there is a load, there is a treatment. There is also approach is being written in the literature, that's the parasite in refugia. Parasite in refugia, it means the some of the animals is not being dewormed. That is no anthelmintic being used. Means it is for the maintaining the susceptible strain of the parasites. Because if you are using the anthelmintic in all animals, there is a possibility that the anthelmintic resistance strain is being developed in the whole farm. So there is a strategy being advised that you maintain some of the animals. It is classed as a refugia animal where the susceptible state is being maintained. So they may dominate at some point of time, and you can avoid some level of the resistance in the parasites. Next one. Yes, the chemical residue in meat and milk is an important consideration because when you are opting and selecting a drugs, if it is coming through the meat and milk, it should be in your knowledge because you have to transfer information to the consumers at what time the days this is being secreted through the milk or it's available in the meat animals. So thiabendazole is one of the oldest anthelmintics which is being used, and withholding period the thiabendazole is very less because it is very quickly being cleared from the system. So this is the advantage of this drug because it is being cleared very easily. There is no problem of residue, but the disadvantage is that it is being cleared very easily, so the efficacy is not as a good efficacy to the parasites. So considering all these things, another benzimidazole compounds like fenbendazole, oxybendazole, albendazole is being invented. They are having more persistent level in the blood for a longer times. So the milk discard, the meat utilization after slaughter, they need a definitive period of time. There are the different drugs like closental, rifaxitinib. They are combined with the blood proteins, they are remain for a very longer time. So sometimes the consumption of the meat is needed higher time. So up to 30 days you cannot use the meat. Similarly the milk also. Levamisole and morental having a very short life, so they can be used in the food animals. Ivermectin and doramectin, it need a special consideration because they are not being practiced in the lactating animals. Because up to a 3 week to 4 week of time, this is being secreted through the milk, and this is very toxic to the human beings. So it is not being advised in the lactating animal. So it needs a special consideration, a special message to the consumers. Moxidectin comparatively lesser than the ivermectin and doramectin, and sometimes